Hi, my name is Caitlin Bland. Me and my partner Callie, we did death and dying rituals within the Hispanic culture. This is particularly close to me because I work very closely with hospice, and I care for a lot of end of life for hospice patients. Family relationships. Family and close friends are important in the Hispanic culture. Family and friends strongly rely on each other for emotional support during difficult times. Um, with that, they like being involved in a patient's care. Some prefer to care for the terminally ill patient of the family members over the healthcare professionals. And also, it's normally the women that care for the terminally infirmal. Unlike other places, they'll go in Western culture, they'll go to hospice care centers or long-term care facilities. Religion, faith. Um, Hispanic cultures are very religious, and many of them are Roman Catholics. Death is seen as the soul returning home rather than a mourning time. It's a time of freedom. Last rites are given to a dying patient on their deathbed by a priest. This is a very important tradition for the Hispanic culture. Caring for a dying Hispanic patient. The most important thing to remember is to never assume just because you have a dying Hispanic patient does not mean that every Hispanic patient has the same set of beliefs. You have to talk to your patient and patient's family and get to know them and figure out what their wishes are on an individual basis, not just because they're Hispanic or Catholic. They may not believe the same beliefs that the mainstream um, Catholic people believe. When talking to your patient, it's important not to use slang terms or fancy advanced medical terminology. Due to language barriers, it's easy to be misunderstood even with an interpreter. So, to really understand their dying wishes, it's better to use simple terms that are easy to translate and easy for them to understand if they do speak English. Include La Familia and care. Um, Even as simple things as swabbing out the patient's mouth, suctioning them with a yonker if they need to be suctioned, it makes them feel like they're part of their care. And like I said, most Hispanic families don't like keeping their family member in the hospital. So this gives them a chance to feel like they're part of their care, even though they're in a place that they honestly would prefer not to be during this time. Um, Give the family time and space to do any religious practices that they choose. Although, like I said, not all Hispanic families have the same beliefs, religion is often a foundation of many patients, and it's important to read the room and allow them time to complete religious practices that they may want to complete. Simple tasks like vitals or bed changes can wait until after the practices are completed. Um, Remember, as I said before, not all Hispanic patients are Catholic. There are so many types of beliefs among Hispanic patients. Although that is the most common, if you assume that, you could upset the patient, and it's kind of profiling in a way. So talk to your patients, find out what they need from you, whether it's contacting a priest or what a simple task like having their favorite food or drink for them is really important. The most importante point to remember is to remain culturally sensitive. Do not judge and respect the patient's and family's wishes. Just because it's not what we believe, we have to still respect them and be culturally sensitive. If you were in that situation and you knew how your mom liked something, you would want to be cared for in the same manner. Hispanic culture holds respect so as a very important concept of their culture, and also includes during the dying process. Most older patients prefer senor or senora. The same way we would go yes ma'am, no ma'am, yes sir, no sir. They they expect the same thing, and if you're able to gain their respect, it makes it a lot easier to care for them, and they're more likely to open up to you as a healthcare provider if you provide them with the respect that they deserve and expect. Important traditions. Many traditional Hispanic families want to do the majority of the care for their dying patients. They prefer to stay at home and not in a facility like a hospice care center, long term care facility, or even if they go for a short stay in rehab. They would prefer just to keep the family members at home and do a lot of the care. A lot of the women stay at home with their families anyway, so it's just viewed as another part of their job at home. The family as a whole are actually against hospice, which can sometimes make things like pain control a little bit more difficult. Um, some traditional Hispanic patients view pain and illness as a test of faith. So this may impede a patient to receive pain medication for them to remain comfortable. If they are viewing as this a test from God, then they don't want the pain medicine to lessen the pain. They want to show God that they're able to go through anything that they throw towards them. So they oftentimes refuse the pain medication. A common tradition for many Hispanic patients is the last rites. Um, with the last rites, it's a common practice. It's when the priest comes and anoints the patient with holy oil and listens to their last confession. This is done on their deathbed, but it's important to remember um, that you need to call them in a timely manner so they're able to complete their last confession, because at the end of life you're not able to talk, you're not able to eat, you would not they wouldn't be able to give their last confession. The Day of the Dead. The dead are still members of the community and their view. So, what is the Day of the Dead? The Day of the Dead is a celebration of both life and death. The holiday began in Mexico, but is now celebrated all over Latin America. It gives the family a chance to remember their loved ones in a positive way. Actually, in pre-Hispanic culture, it was viewed as disrespectful during de los Muertos to mourn the dead. They wanted to celebrate the day that their loved ones passed. This will also be seen at the bedside with patients. They view death as an opportunity for the soul to be set free rather than a time of sadness and mourning. During the Day of the dead briefly return to Earth, and that's when they're able to remember their loved ones. A centerpiece of the celebration is Ofrenda, built in family homes and cemeteries, honoring lost loved ones. Um, it's an it's kind of like an altar in a way. They put all the things that remind them of of their loved ones, their flowers, colorful art, just a memorial for their loved ones. But they also have beautiful food, or wonderful food, beautiful costumes, colorful art. It's a great day.